Hello, everyone, and welcome back to the 9th annual CR Arthritis event at the Canadian Rheumatology Association annual scientific meeting. Today, I'm joined by Dr. Torgerson, who is the Director of Experimental Immunology at the AHPA Institute in Seattle. Dr. Torgerson's research has focused on the characterization of genetic mutations that cause the immune system to become unregulated. This can lead to what we know as autoimmunity and susceptibility to infections. Dr. Torgerson, it is an honor to speak with you today.
Likewise, it's nice to be here.
Thank you. Can I ask Dr. Torgerson, can you tell us a little bit about yourself, your training, and perhaps how you're involved in rheumatology? Because it seems like it's not quite a direct involvement.
Well, yes and no. So I'm actually I'm a pediatric rheumatologist by training, and pediatric rheumatologist and immunologist, and I have really focused on this area of rheumatology, rare diseases that patients that have genetic mutations that cause a susceptibility to developing autoimmunity, with the idea that by understanding those, it will help us to understand other autoimmune diseases that are maybe more complex than a single genetic mutation, and may inform our ability to do that. So that's been my career, and I clinically I've focused on again pediatric rheumatology, but more on the immunology side and patients with immune dysregulation. In other words, how does the immune system go off the rails in the setting of one of these diseases? At the Allen Institute, we focus more broadly on immune dysregulation, but we do that in the setting of autoimmunity, cancer, and infections. And one of the diseases that we are studying at the Allen is rheumatoid arthritis. We're focusing on very early stages. So patients who have biomarkers in the blood that suggest that their immune system has already started to veer down a path that it shouldn't, but they haven't developed full-blown arthritis yet. Mm-hmm. And we know from really nice work done by colleagues that we collaborate with that those patients, once they show these signs that their immune system is sort of veered off the rails, most patients ultimately go on to develop arthritis at some point in the future. So we're studying patients longitudinally, doing deep immune studies on them. So using a variety of really cutting edge tools to try and understand how their immune system evolves to full-blown autoimmunity in the setting of rheumatoid arthritis.
That's incredibly telling work, and you have to forgive me for my own, lack of knowledge in this area. But it is, as you said, like it is very much so a direct involvement in the field of rheumatology. And I think, from my own perspective, I always think how the environment causes all of these rheumatological conditions versus it's not quite that. It's not one or the other. It's not, there's a genetic cause, there's a environmental reason, but it's a combination of a lot of different factors.
Yeah, it's actually, so I have focused much of my career on the genetic side of things, and I actually, I have a strong feeling, and there's growing evidence to suggest that there's certainly a genetic underpinning. There's a genetic susceptibility that people have for their immune system to break tolerance or to veer down a path that it shouldn't. But the environmental exposures, depending on what your basic makeup is, for one person, an environmental exposure may send them down a path that they shouldn't go, whereas others it may not. But I think that there's growing evidence that certainly the underlying genetics play a major role in terms of susceptibility to develop autoimmunity. And there's some new diseases that really suggest that acquired mutations, which we all acquire, the longer you live, as your cells are replicating, they are making mistakes in the DNA. Every time a cell splits and makes two new cells, there's a chance of making a mistake in the DNA, and some of those mistakes then go on to drive autoimmunity, and it's difficult to identify those, but there's been some recent successes that have really highlighted how that may be the case in adults who acquire autoimmune diseases. Some of them acquire those because they've acquired one of these mutations that some people are born with.
You know, I just see how this work is so valuable, because if you're able to know what mutations cause this, then you're able to detect it, and then you're able to provide treatment or self-management at an earlier stage. So this is really revolutionary.
Well, and not only at an early stage, but you're able to actually hopefully provide a treatment that somehow targets what is actually happening in the cells at the molecular level. It's not it's not exactly precision medicine, but it's getting close. It's really targeting therapies based on what we understand about the molecular drivers of disease.
Wow. That is absolutely fantastic. I cannot wait to hear and learn more. And I'm sure the residents who will be attending the Immunology 101 component of the CR Arthritis event are also extremely excited for this. Dr. Torgerson, can I ask you to kind of explain in lay language, what is the study of immunology, and perhaps why did you kind of veer towards immunology? Because you are trained as a rheumatologist, a pediatric rheumatologist. Why the interest in immunology?
Yeah, so I think about the immune system as really it is it's like your military. So your body is like a country, and you need some tools to prevent your country from being invaded by bacteria and viruses and fungi, the various pathogens that would like to come in and take over your country. That's been really evident during the pandemic, where we've all sort of. I used to tell people I was an immunologist, and they're like, "Oh, that's nice." Now it's like, "Oh, an immunologist," So people have heard the word at least before. So the immune system really is your defense mechanism, and like a country that you have multiple defenses. You might have an air force and a navy and ground forces in a country to protect yourself. It's similar in the immune system. There's different divisions of the immune system that protect you from different types of pathogens, and those divisions get ramped up to fight off an infection, and they should be then appropriately ramped back down once that infection has gone away. And what we think happens in the setting of autoimmunity and autoinflammation is that it is either inappropriately ramped up, it's triggered like when it shouldn't be, or it gets triggered in response to viruses, bacteria, things you might be exposed to in the environment, but it doesn't get ramped back down appropriately. And so we're trying to better understand both of those mechanisms. And really, rheumatology is immunology. I mean, it's really, it's just the study of, we see patients in rheumatology where the immune system has sort of, again, I say it goes off the rails. It's just become misdirected and inappropriately responding in one of those ways. So anyway, that's why it's important to study, to really study the basic mechanisms, the basic immune mechanisms, because those have direct impacts on what patients are experiencing and how patients, are being treated. So that's how they're linked together, and that's why that's why as a rheumatologist, I've been very focused on these genetic immune diseases that really that predispose you to developing autoimmunity. There's another group of these genetic diseases that predispose you to just having problems with infections. And those have been called immunodeficiency diseases. But this is a different group of these genetic diseases that we've really come to know about over the last 15 to 20 years. And that's where my focus has been.
Amazing. And really, like you said, it's a younger science, an evolving science, an exciting space to be in. And can I ask you, I know you mentioned some innovations and some tools that you use to do your research. Do you mind sharing or telling us a little bit about what tools you use?
No, I'm sure. And these are tools that have been developed to try and measure single cells, single immune cells. One of traditionally, the way that people have studied immunology was using animal models, and particularly research mice have been a big tool for immunologists. And they're useful because, they can be sort of taken apart. I apologize to anyone who worries about this, but really they have been, it has been an amazing tool to really advance our understanding of disease. But you can't take people apart to do the same things, and so you have to be able to study small bits of material, samples from blood draws, biopsy material from tissues. You can't just take a spleen out and dissect it like you could potentially in an animal model. And so to do that, it's required the development of really new cutting edge tools that allow us to look at what types of cells are there in the blood and in the tissues, which is where a lot of the activity is happening. It's out in the tissues, it's not in the blood. To what cells are there, and now to really understand what they're doing in terms of talking to one another, what activities they're having. I think of it as being like, you are curious about what's happening in a local bar or restaurant. So what do you want to know? Well, you want to know who's in the bar or restaurant, and you want to know what they're saying to each other, right? And that's essentially what we're doing. We're trying to understand who, but really at the single cell level, at the individual level, who's in the tissue and what are they saying to one another? How are they interacting, and how are they? How does that then impact? How's that different than what we would see like in a healthy individual? Where what's wrong there? So these tools allow us to take single cells, either from the blood or from tissue, and to tease that out using a variety of techniques like flow cytometry, single cell RNA sequencing, and a number of cutting edge tools to do that.
Really.
I don't know if that makes sense. It gets really, it very quickly goes really technical fast. So I'm trying to keep it on a more simply understood level.
So well explained. And like you said, the goal is to be, if we want to understand, understand some of the root causes, the pathways that lead to autoimmunity, as you said, we have to look. We do have to do that deeper dive, and that is your research of looking at those very specific single cells. And now that we have the tools to do it, it's so exciting as you push the field forward. So I think that was really well explained. Thank you for that.
Yeah, absolutely.
And then my last question is, do you have any insight, tips, tricks that you would share to help improve a patient's disease journey? Anything they should maybe look out for in future in terms of therapies?
Yeah, there's a whole host of new therapies coming down the line. And I think, one of the challenges that we all have is understanding how to use these drugs and which subgroups of patients are going to respond better to a particular therapy versus another. And I think that this is where these sorts of tools will have applicability. I think from the patient standpoint, one of the things I really suggest to all patients is that if you're concerned about where things are, or you don't feel like you're getting answers, it's okay to get a second or a third opinion. And I actually encourage patients to do that sometimes. Even, I think some providers may view that as sort of, oh, you don't trust what I'm saying. But I I actually encourage my patients, go get a second or third opinion. No, there is so much knowledge out there that there is no one person who knows it all. And it may be that someone else will have a brilliant idea that may help us to understand better how to treat this disease. So I think that I would encourage people to do that. I think, you know, and you know, really my hope is that as we use these tools and understand how to use them, we can actually develop tools that are clinically applicable as well. It's at the moment, it's hard to apply these research tools clinically, but I think we're in a period where hopefully soon some of these research tools are going to be available clinically to better understand every patient's journey, not just those ones who happen to be at a center where they get enrolled in a research study. And that, we need to make these more broadly available across the whole community of patients. And I think that's, watch out for those things and take advantage of those as they come available. And again, being on the research side, certainly it is so valuable. It's so valuable to us as on the research side to be able to partner with patients to do this work. There's just, I mean, every patient is living their own journey, but for us, it's like this incredible gift that we don't, I mean, it's an amazing thing for us, and hopefully for others who are on the same or similar journey too. So anyway, that's would be my pieces of advice.
Dr. Torgerson, as a patient myself, I have to say that that was so empowering to tell me, like, oh, I should go seek a second opinion, because sometimes I'm like, oh, I take some things with a grain of salt, and I'm like, I know I'm not qualified to take it with a grain of salt. I should be taking it in its full face value. But that's really empowering for myself, and really exciting that there are new therapies. And so I'm so grateful. I'm so grateful to be alive in the moment where I will have access to these, hopefully sooner rather than later, but
yeah,
have that hope. So I do want to thank you, number one, for your time, for your expertise, for sharing that with us, and really for the work and all that you do to move rheumatology forward. So thank you again.
Thanks, Owen. Appreciate it. Thanks for talking to me.
Absolutely. And with that, we're going to say goodbye to everyone, and we will catch you on the next episode at the CR Arthritis Vet. Thank you. Bye.